I'm Dr. Barry Eppley, plastic surgeon of Indianapolis. I wanted to review some basic steps for ear reconstruction in congenital microtia. Congenital microtia is where a child unfortunately is born with either part or most of the ear missing. Usually there remains an ear lobule present, but basically the entire cartilage framework of the ear is absent. Through a series of well-known and established ear reconstructive procedures, an semblance of an ear can ultimately be created through this series of operations, otherwise known as staged microtia. The first stage of microtia reconstruction is the most important and is the biggest operation. This is where cartilage is taken from ribs 6, 7, 8, and sometimes 9, and the entire cartilage framework is reconstructed. This is probably one of the few plastic surgery procedures where we actually sit down and really try to carve out a structure, with the objective being to create an ear cartilage framework that looks like the ear. And therefore, portions of 6, 7, 8, and 9 rib are put together to make that framework. A template is taken usually from the opposite ear and then positioned so that it is situated symmetrically to the normal ear. This then allows the size as well as the position of the framework to be placed. In surgery, many times there are cartilage remnants that are left of the ear, and these need to be removed, leaving only the lobule behind. Then through this excisional area, the cartilage framework is inserted and placed under drains so that the skin immediately sucks down over the framework into the grooves and this usually creates a very dramatic appearance right at the time of surgery. The lobule may still be displaced and almost always is, but the most important step of getting the cartilage framework in place is next. Generally 6 months after that procedure is complete, we move on to the more minor stages, which usually begins with the second stage of a lobule transposition. The ear lobule, as you can see, is not remotely in proper position on the framework, and it needs to be rotated back and into proper alignment. This is a relatively patient procedure, and putting the lobule to the end of the framework really starts to create the appearance of an. The third stage, which most patients need, is that there is no groove or sulcus in the back of the ear. So the ear framework in this third stage must be lifted up and a skin graft placed to create a space behind the ear. This does require a skin graft, usually taken from the last stage in microtia reconstruction is that of the tragus, this nub of cartilage sitting right in front of the concha or bowl. This is the fourth stage, which can be combined with other stages, usually the lobule transposition if possible, where a little graft is taken from the opposite ear and then placed in to create that cartilage bump so that one is not looking directly into the. Microtia reconstruction today is often combined into only 2 stages and sometimes 3, and does not always need to be 4 as in the traditional approach. Microtia reconstruction, and one is never going to get a perfect reconstruction that looks like the opposite ear, but the goal is to have a reconstruction that looks fairly similar to an ear, thus avoiding the need to ever have a prosthetic ear, which although looks better, are difficult to maintain in place.